Hello, my name is Rachel Knox.
And I'm Bailey Watkins.
And I'm Riley Kitchens, and today we're going to be talking with y'all about the rubrospinal tract. So to get us started, I'm going to be talking about the overall anatomy of the rubrospinal tract. The origin of the rubrospinal tract is the red nucleus located in the midbrain or tegmentum. So the red nucleus is involved in motor coordination and is particularly important for the control of fine motor movements. Moving on to the course of the rubrospinal tract. So from the nucleus, the fibers descend through the midbrain into the pons and medulla. Then most fibers decussate, meaning that they cross over at the level of the midbrain and then travel downward through the lateral funiculus of the spinal cord. Then the tract primarily descends to the cervical regions of the spinal cord, where it then synapses with the lower motor neurons. And then lastly, the rubrospinal tract primarily terminates on the anterior horn cells of the cervical spinal cord. It mainly influences the motor neurons that control flexor muscles in the upper limbs.
There are several functions for the rubrospinal tract. The main function would have to be motor control. It is particularly involved in the regulation of upper limb flexor muscles. The rubrospinal tract helps facilitate voluntary movement, thus contributing to the control of fine motor skills. These skills would include anything such as writing on a piece of paper or playing an instrument. The rubrospinal tract also plays a role in the modulation of muscle tone and reflexes. The rubrospinal tract has a clinical relevance with a variety of different things. For example, strokes, spinal cord injuries, or multiple sclerosis, MS. Damage to the red nucleus or the rubrospinal tract due to a stroke can lead to deficits in upper limb control. Symptoms may include weakness, spasticity, or coordination problems, particularly those affecting the fine motor skills that we discussed earlier. An injury that affects the cervical spinal cord may disrupt the rubrospinal tract's pathways, resulting in paralysis or weakness of the upper limbs. Patients who experience a spinal cord injury may struggle with daily tasks such as dressing or eating by themselves. Multiple sclerosis, MS, can affect the rubrospinal tract through demyelination. This leads to similar motor control issues. Symptoms of MS often include fatigue, coordination difficulties, and muscle spasms.
Our case study, The Impairment of the Rubrospinal Tract. Our patient profile was a 60-year-old man with no previous health conditions and lived a pretty active lifestyle prior to the incident. The patient experienced a left-sided stroke, which resulted in damage to the red nucleus. This affected the rubrospinal tract, leading to motor deficits in the upper right limb. During evaluation, some of the symptoms that were noted was weakness in the right arm, particularly in the flexor muscles, poor coordination and fine motor control. The patient had difficulty with fine motor tasks such as buttoning clothing, writing, and grasping small objects. The right arm also displayed signs of spasticity. This was increased by muscle tone and resistance to passive movement. And then a little bit of postural instability, just difficulty maintaining balance, like when reaching for objects. Some of the therapeutic interventions, like occupational therapy, would be adaptive techniques and adaptive tools such as dressing aids, for example, like button hooks or a shoehorn or anything like that. And then also implementing weighted items such as weighted utensils and objects to help improve grip and control during eating. For fine motor skills, just repetitive practice and task-specific activities. To sum it all up, the rubrospinal tract is essential for voluntary motor control. especially in the upper limbs. Damage to this pathway can lead to significant deficits. But with targeted therapeutic interventions, such as occupational therapy, this can help support the recovery in affected individuals.